Welcome to Thrive with Pride by AgeOptions, an inclusive online space for LGBT older adults and those who care for them. This is a recording of a live event held on Zoom, which included a Q&A segment that was not recorded. This month, we welcomed Avisery by AgeOptions to educate participants on how to prepare for Medicare open enrollment period and get support if needed. They also highlighted some of the key benefit changes, caveats, and costs. Please see the video description below for a PDF of the slides presented in the recording and other helpful resources.
Good morning. My name is Stella Vandeneden. I use she, her pronouns, and I am with Avisery by AgeOptions. We are a program that typically trains professionals on Medicare and Medicaid topics. However, we sometimes do presentations for consumers, such as the Thrive with Pride presentation. I believe this is our second year doing this. So if you were here last year, you may have heard my manager, Elizabeth Jerkin, give a presentation. So I've been with Avisery for 3 years, training professionals, as well as being a senior health insurance program counselor, a SHIP counselor, counseling older adults on their Medicare options. So I'm going to share my screen, and then we will get right into how to prepare for the Medicare annual open enrollment period. All right, so before we get into how to prepare, we're just going to do a quick overview of how Medicare benefits can be structured. A person can either be in original Medicare, where they will have their Parts A, which is the hospital insurance, Part B, their medical insurance. They may have a Medigap or a Medicare supplement plan, and then they'll have a Part D plan, which will cover their prescription drugs. And those things will sort of be separated, but they will all coordinate together. Or they could be in a Medicare Advantage plan, which is also known as Part C. And this is sort of like they have one health plan that will encompass their Part A and Part B benefits, and most will include Part D. So when we talk about the Medicare annual open enrollment period, it will mostly deal with either a Part D prescription drug plan, which will be with someone who has original Medicare, or it will be with a Medicare Advantage plan or a Part C plan that will encompass all of the Medicare benefits under one plan. So what is the Medicare annual open enrollment period, or it will sometimes be talked about as OEP? And it is a chance for Medicare beneficiaries to review their Part D prescription drug coverage or their Part C, their Medicare Advantage plan coverage, and to make sure that whatever plan that they are currently in will work for them in the upcoming year. So plans change every single year. They may change in terms of costs or in terms of coverage. So this is why it's important to use this opportunity to review your health coverage to make sure that it'll continue working for you financially as well as coverage-wise. So this lasts from October 15th to December 7th. And during this time, you can make a decision whether to change your Part D plan or change your Medicare Advantage plan, or to either, if you're an original Medicare, to enroll into a Medicare Advantage plan. Whatever decision you make during this time period, it will not take effect until January 1st of the next year. So come January 1st, 2024, your decision will be in effect. This time period does not apply for Medigap or Medicare supplement plans. I've gotten some questions about this during this time period. If you do have a Medigap plan, you typically do not have to review that coverage annually. So how to prepare? The first thing is to keep an eye out for your annual notice of change, or ANOC. This is a notice that plans, both Part D plans and Part C plans, will send to you by October 1st. So if you don't have this notice in your mailbox by October 1st, feel free to contact the plan that you are currently in and request one. This plan will list everything that is going to be changing within the upcoming year. So it could be a change in premium, which is a monthly payment that you pay for the coverage. It could be the deductible could change, as well as the drug coverage. Maybe they're no longer covering a drug that you were taking, as well as the copays, the out-of-pocket costs that you pay for drugs or services may be changing. So this is just to let you know. Once you get the ANOC, that is when you can start comparing plans if you would like to. We suggest, even if your plan's not changing that much, say that they're still covering the same amount of the same drugs that you need to be covered. We still suggest comparing plans because there may be a plan out there that covers the same drugs but is more cost efficient for you. We also recommend making a mymedicare.gov account. If you do make an account online through mymedicare.gov, it will compare the plan that you are currently in with other plans, and it's very personalized. And I will be going over on how you can compare plans online in later slides. And then lastly, we recommend making an appointment with a senior health insurance program or SHIP counselor. SHIP counselors are free, unbiased Medicare counselors that can help you navigate your options, as well as help you look into plans and compare plans as well. If you are looking to make an appointment with a SHIP counselor, I recommend making an appointment as early as possible because time slots do fill up rather quickly. If you do go to a SHIP counselor, here's some information that you should be bringing to your SHIP appointment that will help your counselor find options that will best suit your needs. First is your Medicare card. They're going to ask what your effective Medicare dates are for their own personal records. A list of medications, and it should be the name that they appear on the bottle. We know sometimes when you're in conversations with doctors that doctors may refer to a drug by the brand name, but then in reality, they are prescribing you a generic drug. So it's important just to give a list of medications to the counselor that and it shows as what they appear on the bottle. This will affect the price, and SHIP counselors would like to accurately reflect the price that you would be paying when looking into drug coverage. You do not need to include any over-the-counter drugs that you take in your list of medications. For Medicare Part D plans don't cover over-the-counter drugs. What pharmacy you use may also affect the price of your drugs. So if you do have a pharmacy that you really are attached to and want to use, bring that to your SHIP counselor so they can look into and see if it may be cheaper to use one plan versus the other based on your pharmacy preference. If you are looking into Medicare Advantage plans, also bring a list of preferred health providers. Medicare Advantage plans only work with certain health providers. A provider has to be in network. So this will sort of help your counselor find a plan that will work with the providers that you would like to go to. And then also, if you are looking into a Medicare Advantage plan, just be prepared that your SHIP counselor may ask you questions about your health, as well as the health types of specialists that you see. For Medicare Advantage plans may need a referral to see a certain specialist. So it's just one way to maybe narrow down your choices, depending on how easy it is to see your specialist. Other additional tips that we have, if you do meet with an insurance broker, we do recommend verifying information with a SHIP counselor. Not that the information will be incorrect, but a SHIP counselor may be able to find a plan that has covers the same things, but it may be cheaper for you than the plan that the insurance broker works with. Regardless of whether it's a insurance broker or a ship counselor telling you that your provider does accept the plan, I also recommend double checking with your provider's office. As a ship counselor, I've used the health insurance website to figure out if if a provider is a network or a provider's website, and sometimes that may not be the most updated. So it's always best to go straight to the source to see whether they will accept the plan. And another thing is just to know your options. If you are enrolling into a Medicare Advantage plan during the open enrollment period, you will have another chance from January 1st to March 31st to make a change if it turns out that the plan that you chose will not work for you in 2024. Now, the Medicare.gov Plan Finder is the place where you can compare plans. It is a user-facing website, although sometimes some information may be hidden, so you can always contact a ship counselor to help you navigate the plan finder. But on the plan finder, you can compare costs, coverage, see if any of your drugs have any restrictions under a plan, pharmacies that are in network, as well if any of your health services have any restrictions under Medicare Advantage plans. This can include something called like prior authorization, where you need the plan's approval. And all that information is in the plan finder. Also, other information that you can find on the plan finder is what extra benefits that Medicare Advantage plan will cover that goes beyond original Medicare. Some of the more common ones will be any dental, vision, or hearing coverage that they may provide. And then lastly, if you used Plan Finder last year, there's been some updates that we would like to draw your attention to. The first two bullets are things that were set in place due to the Inflation Reduction Act, and once they were set in place too late for them to edit the plan finder to reflect those provisions, and that includes that now insulin is capped at a $35 copay for insulin that is covered by the Part D or Part C plan. So now last year we had to do a bunch of math to figure out what the true costs of someone's drugs would be if they took insulin. Now that $35 cap will be accurately reflected. Additionally, vaccines and also now have a $0 cost sharing under Part D, whether it be through a standalone prescription drug plan or a Medicare Advantage plan, and that is also will be reflected. And additionally, if you are in a Medigap plan, that Medigap enrollment will now appear in your MyMedicare.gov account, and it can be used to help compare what costs will be when you're looking at other coverage options. So these next two slides, I may not have time to go too deep into it, but these, I know Nina will be sending the slides out later, and these are sort of things that you should be looking for when you're comparing and considering Part D plans, and then the next slide is for Part C plans. The overall gist are the 4 C's: costs, coverage, convenience, and company. And we sort of provided some guidelines under each of those 4 C's that can help you when you're going through your options. And then next, that's going to be sort of new for 2024 is some provisions of the Inflation Reduction Act. The first one is that the income limit for full extra help is increasing. So extra help is a federal program that helps with drug costs. If you qualify for full extra help, there are some Part D plans that are $0 monthly premiums, and then copays can be as low as around $1 to $3. We don't know what the exact costs, what exact copays under full extra help will be for 2024. That has not been announced yet, but that should be coming out soon. So they have raised the income limit to 150% of the federal poverty level. Before it was 100%. Again, the exact monthly income and asset numbers, I don't know yet. That has not been released. Information has been released, but it should be released soon. Additionally, there's something called there will be no cost sharing in the catastrophic coverage. Part D coverage is sort of split into phases depending on what your true out-of-pocket costs are, and that is what you pay and what the plan pays. And once you reach $8,000 of your true out-of-pocket costs in 2024, you will no longer have any copays. And your plan, your Part D or your Part C plan, will keep track about what phase you're in and how much your true out-of-pocket amount is, and they will be sending you monthly notices with that information. Additionally, a new thing that with Part D will be the new Medicare prescription payment plan. And this is something that Part D has to offer all of their enrollees. And it is the option to take a high out-of-pocket cost for a drug and spread it out monthly instead of all at once. And if you do elect to do this, the plan will just send you a monthly bill. So this doesn't necessarily reduce your costs, but it just spreads it out instead of having to pay a high price right at the pharmacy. Another thing that you may have seen in the news is that due to the Inflation Reduction Act, Medicare can now directly negotiate for prices. They have released the 10 drugs that they will be negotiating prices for in 2024 and 2025. And then those prices will be effective in 2026. And then in the following years, more drugs will be added to this list. And then lastly, this is something that isn't open enrollment period related, but this is a common issue that we've been sort of seeing with Medicare benefits. And that is people being denied Medicare coverage at skilled nursing facilities due to not improving their condition. And this is something that we just wanted to make you aware of. This is regardless of whether you're an original Medicare and Medicare Advantage. Medicare does cover up to 100 days at a skilled nursing facility after a 3-day inpatient hospital stay. And we've seen that Medicare beneficiaries have been denied care due to not improving. However, there was this lawsuit 10 years ago called Jimmo versus Sebelius that has established that improvement is not a requirement for skilled care. People can still qualify for skilled care if it does maintain their condition. So if a facility believes that your Medicare coverage will end, they should be giving you a notice of Medicare non-coverage. And if you feel like it's been less than 100 days and you still need this care to maintain your condition, you should be given the contact of the Illinois Quality Improvement Organization, Levanta, and along with that number. And if you feel like your care is ending too soon, you can always contact that number and they will help you appeal that decision and help you stay in the skilled nursing facility. Here are some helpful resources. The first I have is the number to find your local SHIP counselor. This is the number that the Illinois Department on Aging provides. Once you call them, they will connect you with a SHIP counselor that is in your area. I also included the link of the Medicare.gov plan finder that you can use to look in for plans. If you click the link now, it will still only show 2023 plan information. However, by October 1st, they should start showing 2024 plan information. So you can start looking and comparing plans by October 1st. I also include, if you need any more information about Medicare, Medicare.gov is a great resource. I've also included the number for Medicare. If you cannot find any appointment with a SHIP counselor and you would like help, Medicare representatives are also able to help you look through your Part C and Part D options. I think a previous presentation that we've been done has been shared in the flyers, and that may have had some outdated Medicare costs. So I've also included a link for 2023 Medicare costs, and also that site should update with 2024 costs as well once those are released. And lastly, if you want some more information about the Jimmo versus Sebelius lawsuit, I've included a fact sheet as well. All right, and now we have any time for any questions that anyone may have.
Thanks again to Avisery for joining us this month. Don't forget to check out the video description below for the slides from their presentation, other helpful resources, and a brief survey. We hope that you will join us again next month on October 24th. In honor of LGBT History Month, we'll be hosting a unique virtual community event featuring 2 storytellers from Chicago Methodist Senior Services Gold Program. The Gold Program amplifies the voices of LGBT older adults to promote inclusion in aging services. Sign up for email reminders of future events at www.thrivingwithpride.org. And again, please don't forget to fill out our survey so that we can continue to provide and improve our programming. Thanks for watching.